when it comes to artificial intelligence, and there's a lot of conversation, and I've seen
Mm-hmm.
a lot of work around retrospective studies,
Mm-hmm.
and then even kind of going off of what you said, because underrepresented people don't participate in clinical trials a lot. There's these blind spots in the data. I've heard a lot of people talk about producing things like synthetic data, or like kind of creating digital twins. Do you have any thoughts on where you think kind of health information in general is going, as we kind of head more towards this kind of personalized health where the systems need to ingest a lot of information?
Mm-hmm.
How do you see that landscape evolving, just in your opinion, with
Mm-hmm.
the populations that you work with?
Yeah.
Do you see them more open or closed to that, or what do you think?
Yeah. So I think we don't have a choice. It's exciting, but also scary.
Mm.
So some providers are a little, they're not ready to embrace AI just yet. But I see it to be a useful tool that we can incorporate in our patient care.
Mhm.
So as far as in the you get out of AI what you put in. So that's a very important area. We have to be careful about the information that we feed it. And I think it's in its early stage, but over time we will learn more how to input information in it and what we expect to get out of it.
Mhm.
Um,
What areas of research do you hope that we focus on more? Yeah, what are the areas that you're looking forward to seeing more research done on?
so cancer disparity, not just to highlight the disparities, which is what we are used to doing, but also to make a conscious effort to address those disparities.
Mm,
Uh,
interesting. And as far as when it comes to looking at how
mhm,
cancer maybe impacts specific subgroups, how do you see kind of the standard of care, like standard of communication, changing over time? Is that something that is even possible? I feel like as we get hyper specific, it
mhm,
almost feels like it becomes harder and harder to, areas are already underfunded. So when it comes to kind of these hyper specific subgroups, or even some ethnic groups, we see people that have, like, certain myelination, or what have you. So do you think that it's realistic to get that granular when it comes to patient communication, or what are your thoughts on that?
yeah. So that's a very good and interesting question. Yes. It's getting more and more complicated, but at the same time, we endeavor to give each individual patient the best experience. So as much as possible, we try to tailor all that we do, how we communicate with the patient, how we understand their disease to the patient.
Mm.
Um, it's not always easy to achieve that in totality, but we do for sure aim to give the best outcome possible
Mm.
in that regard.
What do you wish that patients knew about advocating for themselves when it comes to navigating the medical system? Where do you see kind of that gap in kind of understanding what's possible? What do you wish they knew?
Yeah. So I would say you're a partner. You're not just someone who is being told what to do and being recommended things. You're in partnership with your provider. So ask questions, do your own research, and don't be afraid to question whatever treatment recommendations are presented to you. You have the right to choose, and always be sure to make an informed decision. So you should be given all the information that you need to decide on what to do. Yeah. Yes.
Wonderful. Well, this has been an amazing conversation, Dr. Brown. Thank you so much for joining us on MD Newsline Podcast. It's been
Thank
a
you so much for
pleasure.
having me.